Hey friends, it's Dr. Charles Modlin, your friendly urologist, kidney transplant surgeon, and health equity champion. I'm here with another edition of my health equity briefs, and Dr. Charles Modlin speaks. As a reminder, these health equity briefs are an opportunity for me, Dr. Charles Modlin, to impart upon you, the listening audience, information that I believe is germane and very important to improve the health of yourself, your family, and your community. Today's subject is going to focus on mental health disparities with respect to depression, stress, anxiety, hopelessness, and helplessness in African American populations. I think it's very important that we do focus on mental health issues. Um, Mental health disorders, including hopelessness, helplessness, despair, depression, anxiety, and post-traumatic stress disorder, PTSD, are significant public health concerns that can severely affect an individual's quality of life. African American men and women, unfortunately, adolescents and children as well, experience mental health challenges at rates comparable to or higher than their white counterparts. Yet they often face disparities in diagnosis and delayed diagnosis, treatment, and outcomes. So, in this health equity brief, I'm going to examine the incidence of these mental health disorders among African Americans, the underlying causes of such disparities, treatment options, and strategies to mitigate these issues. So, let's get started. Speaking of depression, statistics demonstrate that approximately 17.3% of African American adults report experiencing depression, compared to about 15.3% of white adults. Outcomes show that African Americans may experience more severe symptoms and longer durations of depression due to various social and economic stressors. Speaking of anxiety disorders, statistics demonstrate that the prevalence of anxiety disorders is similar across racial groups, yet African Americans often report higher levels of anxiety symptoms due to the cumulative effects of discrimination, racism, and socioeconomic challenges, of which I've spoken of in several previous health equity briefs. Speaking of outcomes, anxiety may manifest as generalized anxiety disorder, panic disorder, or social anxiety disorder, impacting an individual's daily functioning and quality of life. Speaking of PTSD, post traumatic stress disorder, statistics reveal and research indicates that African Americans are at a greater risk for PTSD due to higher exposure to violence and trauma. Studies suggest that nearly 9% of African Americans may experience post traumatic stress disorder at some point in their lives, compared to 7% of white individuals. African Americans with PTSD often report more severe symptoms and functional impairment, exacerbated by a lack of access to appropriate treatments. Hopelessness and helplessness statistics and study have shown that feelings of hopelessness and helplessness are prevalent among African American adults, particularly in the context of socioeconomic challenges and systemic racism. These feelings are closely linked to depression and anxiety, contributing to overall mental health disparities. Now, the causes of these mental health disparities are similar to many of the causes of other disparities, more likely to be experienced by African Americans, and are related to uh, multifactorial causes of socioeconomic factors related to higher rates of poverty in African Americans, unemployment, low educational attainment, all of which contribute to increased stress, stressors, and mental health challenges. Racism and discrimination and systemic racism, everyday discrimination can lead to chronic stress, As I've spoken about before, chronic stress, psychological stress can manifest as physical manifestation of disease as well, hypertension, heart disease, stroke, all of which negatively impact mental health. The cumulative effects of racial discrimination can exacerbate feelings of hopelessness and helplessness and despair. Access to mental health services contributes to these disparities, where African Americans often face barriers to mental health care, lack of insurance, financial constraints, and a shortage of culturally competent providers. We've spoken of before the fact that more minority and African American mental health workers, sociologists, social workers, psychiatrists, psychologists are needed. Cultural stigma surrounding mental health issues within the African American communities can deter individuals and families from seeking help, leading to untreated mental health conditions. Historical trauma, legacy of slavery, segregation, ongoing inequities contributes to collective trauma and the experience within African American communities affecting mental health outcomes across generations. So, what are some of the treatment options for these disparities that are exhibited in African Americans with respect to mental health? So, there are therapeutic interventions, evidence based therapies such as cognitive behavioral therapy, interpersonal therapy, trauma focused therapy. All of these can be effective for treating depression, anxiety, PTSD among African Americans. Culturally adapted interventions may enhance engagement and efficacy. Of course, medications are an option, not generally the first route of treatment or the first choice. However, antidepressants and anxiolytics may be prescribed for managing symptoms, but disparities in access to medication can also limit treatment. Collaboration with healthcare providers is essential to ensure appropriate prescribing practices. And of course, anyone who is placed on medications must be closely monitored, must be able to schedule follow up visits with their caregivers and their prescribers to make sure they are not being over medicated or having complications from these medications. Community support programs, mental health programs can provide culturally relevant support, reduce stigma, and improve access to care. Also, initiatives that focus on peer support and community engagement can be particularly beneficial in African American populations. Holistic approaches include mindfulness, meditation, physical activity, all of which can support mental health and well being. What are some other strategies to mitigate disparities, increase access to care? Again, something we've spoken about over and over again in these health equity briefs: cultural competency training, community education and outreach, advocacy for policy change, research and data collection, continued research focused on mental health needs of African American communities can inform culturally relevant interventions and improve understanding of the unique challenges faced by African American populations. So, in conclusion, mental health disparities among African American men and women compared to their white counterparts are influenced by a complex interplay of socioeconomic factors, systemic racism, stigma, and access to care. By implementing culturally competent treatment options, including increasing access to mental health services, uh, training more African American behavioral health specialists and professionals, and addressing the underlying causes of these disparities, we collectively can work together towards improving mental health outcomes for African Americans and thus promoting health equity. So please like, share, subscribe, spread this information along. As I've always said, one does not have to have an MD degree, DO degree, RN degree, social work degree to be considered a healthcare provider. Just by passing along important health information, you all can save lives. Visit my YouTube channel, my website, drmodlinmd.com. Visit my LinkedIn, X, and Facebook profiles. And until next time, I'm Dr. Charles Modlin, and I'll see you on the next Health Equity Brief. Thanks for being here, and as I always say, stay safe.